I'll start now. Hey guys, my name is Aradnan, and today our topic is about the action of the drug scopolamine, which is also known as devil's breath. So basically, scopolamine is a tropane alkaloid, a type of valuable secondary plant metabolites, which are mostly found in high concentrations in the Solanaceae and Erythroxylaceae families. It is commonly used for anticholinergic properties. Devil's breath is also used as a name for scopolamine when it is used illicitly by criminals to captivate victims. This is the chemical formula with a drawing of the structure. So here it is a competitive non-selective muscarinic receptor antagonist at muscarinic acetylcholine receptors as shown in the diagram. So when we talk about the clinical usage, it is motion sickness prevention and treatment. So you can see the depressive actions as shown in the slide. And one other clinical usage is the irritable bowel syndrome, which is also known as IBS. So now I'm going to pass the slide to my next member, Insha.
Hi, my name is Insha, and I will be talking about the routes of administration of this drug. Since the drug is used for various ailments, there are three main routes of administration. It's also important to note that since scopolamine is in the base form of the molecule, it is not that soluble in water, and it's combined with salts to make it more soluble, such as scopolamine hydrobromide. This increases the routes of administration. Firstly, it is administered through a topical route, which is through transdermal patches and eye drops. To treat motion sickness, it takes about 4 hours to take effect, and the transdermal patch is attached behind the ear. And during surgery, it's also used for post-operative nausea and vomiting. For eye drops, scopolamine is used to dilate the pupil of the eye and is used before eye examinations, before and after surgery, eye surgery, and to treat certain eye conditions such as uveitis. The second route of administration is the enteral route, which is also through an oral route. It's used for motion sickness or about 1 hour before exposure to motion by using pills, and this prevents gastrointestinal spasms. The last route of administration is by the parenteral route, which is through intramuscular administration and intravenous administration. It's used before preoperative sedation, emergency treatment of severe nausea and vomiting. Now I will pass it on to my groupmate Jaishan, who will talk about the mechanism of the drug.
Hi, I'm Jaishan, and I'll be talking about the pharmacodynamics of how this drug works. So scopolamine primarily works by competitively inhibiting muscarinic receptors for acetylcholine. This works because the drug has a high affinity for the muscarinic receptor family with little selectivity for any of the 5 receptor subtypes M1 to M5. These 5 receptors are G protein coupled receptors and are expressed at different levels throughout the CNS. There's M1, which is found in the CNS and gastric parietal cells, M2, which is present in the heart and CNS. M3 are located in smooth muscles and glands, and M4 to M5 are found primarily throughout the CNS. We already know that acetylcholine's primary effects involve regulating physiological conditions, such as smooth muscle contraction, heart rate, etc. And it's also involved in some neurological phenomena having to do with memory, learning, and attention. Since scopolamine blocks acetylcholine from binding to the receptors, the resulting action involves both peripheral antimuscarinic properties and central sedative, antiemetic, and amnestic effects. The effects on the CNS include motion sickness and nausea, where scopolamine's antagonism of the receptors in the CNS, particularly those in the vestibular system and vomiting center, suppresses their activity, reducing the neural signaling that would bring about any of their effects. This alkaloid is also the single most effective agent to prevent motion sickness in individuals. Next is sedation and amnesia, where cholinergic transmission within the CNS can be greatly depressed, which in turn causes sedative effects and in some cases amnesia. This in turn can also affect the limbic system in the brain, which is involved with arousal and memory formation. It also has some effects on the peripheral system, such as the heart rate, where scopolamine blocks the M2 receptors, inhibiting parasympathetic stimulation that slows the heart rate, and this in turn causes an increase in heart rate. On the smooth muscles and glands, the antagonism of the M3 receptors reduces smooth muscle contractions and glandular secretions, which make it useful in treating conditions like irritable bowel syndrome and also reducing salivary secretions during surgery. I will now pass it on to my groupmate, Raid.
Hello, my name is Raid. I'll be explaining the pharmacokinetics of this drug, which is basically what the body does to the drug. I'll be explaining it using the ADME, which is absorption, distribution, metabolism, and excretion. The absorption of this drug takes place via the topical route, internal route, and paternal route, which was explained by my teammate Insha. The distribution of scopolamine has moderate volume of distribution, indicating it distributes widely throughout body tissues. Scopolamine is moderately bound to plasma protein, and it does cross the blood-brain barrier and the placenta. It is also excreted in breast milk. The metabolism of scopolamine is extensively metabolized in the liver. Primary metabolic pathways include hydroxylation and conjugation. The first pass effect is significant when ingested orally, and this reduced its bioavailability. The excretion of this drug is mainly through renal excretion and through metabolites. Only about 2.6% of non-metabolized scopolamine is excreted unchanged. Understanding these pharmacokinetic properties is crucial for optimizing therapeutic use and managing potential adverse effects. Now I'll be passing it on to my teammate, Jennifer.
Hi, my name is Jennifer, and I will be talking about the side effects of scopolamine. Now that we know what scopolamine is and its mechanisms, we're going to be talking about its side effects. Since scopolamine is an inhibitory drug, most of the side effects associated with the drugs are due to inhibition of CNS and PNS. The most commonly reported side effects include dry mouth, dizziness, and somnolence. So these side effects occur because scopolamine's action on acetylcholine is not specific to a single area, but affects multiple mechanisms where acetylcholine plays a crucial role in normal functioning. Now, what do we do if there's an overdose of this drug? If you overdose on this drug, there are numerous side effects that you would experience. Some of them are anxiety, loss of consciousness, seizures, pounding in the ears, and painful urination. In the case of an overdose due to scopolamine, the treatment is often based on the symptoms shown by the patient by providing them with supportive care. In case of severe poisoning, physostigmine is used. Physostigmine, widely regarded as the antidote to anticholinergic toxicity, which is basically the overdose on drugs that blocks acetylcholine receptors. The way it works is by increasing the amount of acetylcholine concentration at the site of the receptors by preventing the breakdown of acetylcholine by the inhibition of the enzyme acetylcholinesterase. This increase in concentration of acetylcholine outcompetes other molecules such as scopolamine hydrobromide, which reverses the effects caused by this drug. Now I will be passing it on to my groupmate Isma for the conclusion and abuse of this drug.
Hi, I'm Isma. I'm going to be talking about the abuse of scopolamine. Scopolamine is abused in different ways, including criminal activity and recreationally. Scopolamine is an odorless and tasteless drug, and although it has a bitter taste if consumed orally, its ability to impair free will is a reason why it's used in drug-facilitated robberies and sexual assaults. Scopolamine powder can be blown onto the victim's face after hours, making it difficult to detect. It has been reported that this drug has been added to food and drinks, and less commonly to moisturizing creams as well. It is also recreationally used for its hallucinogenic properties, most commonly by drinking an infusion from parts of the plants of Solanaceae family. With the active dose of scopolamine being very close to the lethal dose, it's extremely risky and highly unethical to abuse this drug. To conclude this presentation, scopolamine is a tropane alkaloid derived from plants like Datura and Hyoscyamus. Scopolamine works by blocking muscarinic acetylcholine receptors in the central and peripheral nervous systems. It is available in many forms, including transdermal patches, oral tablets, and injectable solutions. Some common side effects include dry mouth, blurred vision, drowsiness, dizziness, and urinary retention. Thank you.